Good morning, everyone. Thank you so much for joining us this morning. I'm Hannah Goldberg with GEEARS, the Georgia Early Education Alliance for Ready Students. We're really looking forward to a great morning together. Before we get started, I would love to just get a better sense of who all is joining us today. And so in just a moment, you will probably see a poll, if our technology cooperates, displayed on your screen. You should see it now. And there are just two quick questions that we would love for our attendees to answer so that we can get a better sense of who all is joining us this morning. Great, I can see lots of answers coming in. For those of you who are just joining us, we do have a brief poll for our attendees to complete so that we can get a sense of where you're coming from and the ages of children that you all serve. And I'm so pleased to see we have some great diversity, both in terms of geographic representation and in terms of the ages of children who are served. We have folks from all over the state of Georgia joining us today. We have folks who work with infants all the way up to older children. And we're so glad to have all of you with us this morning. So thank you for letting us know who all is in this virtual room with us. So as I mentioned, my name is Hannah Goldberg, and I am with the Georgia Early Education Alliance for Ready Students, or GEEARS, which is an early childhood nonprofit. We work to promote high quality early learning and healthy development for children all across the state of Georgia. And our partners on today's event are with Georgia CEAL. And so I would love to turn it over briefly to Dr. Tabia Okenchobe to introduce herself. She'll be helping me moderate today.
Thank you so much, Dr. Goldberg. Good morning, everyone, and thank you for making the time today. I know you could be in so many other places on a Saturday morning, but obviously something drew you to make the time to be with us today. I'm so thrilled about the partnership with GEEARS and all of my partners in good on this panel, and also with you. So just briefly, Georgia CEAL is the Community Engaged Alliance Against COVID. And I think we all agree, whether you knew the term Georgia CEAL or not, most of us are against COVID. We've seen the challenges, both personally and professionally, in terms of friends and family members like mine who have been hospitalized, sick, or who have even died related to COVID. And so this event today is a collaboration representing what is so important. It takes all of us, and it takes you also as leaders, also as parents, providers, to really address COVID recovery. So you'll hear a lot today. And you'll also have an opportunity to think about your why as a leader, as someone who cares about children and who cares about the state of Georgia. So we want this to be of benefit to you. And I'll leave it there for now, Dr. Goldberg. I'll be sharing a lot of resources towards the end of the panel. We want you to pose your questions and for this to be as useful as possible. So thank you again, Dr. Goldberg, for the opportunity. And more importantly, thanks to all of you who've joined the Zoom today. We hope we can give you information and tools you can use.
Thank you so much, Dr. Akintobi. So I do want to just let you all know a little bit of context about our event today and sort of what you can expect over the course of the next hour, hour and a half or so. And so we certainly recognize that as the course of the pandemic has shifted, we know that many questions about COVID-19 and about the vaccine in particular remain, especially among members of the child care workforce. And over the course of the last several months, GEEARS has worked to survey hundreds of ECE and childcare staff to really better understand what those questions are. And we've assembled a really great panel today to help answer some of those questions. We really also want this to be a safe place for you as members of this crucial workforce to ask questions that are important to you, that may be important to your colleagues. And so what you're going to hear today, we'll begin with some panelist presentations, and I will introduce our wonderful panelists shortly. But if you have questions throughout their presentations or really as any questions occur to you, you can feel free to use the Q&A feature through Zoom to submit those questions. And those questions will come to the moderator. And then following our presentations, we will have sort of an open Q&A session. As I mentioned before, we've fielded a lot of these questions over the course of the last couple of months and have assembled some of them that we will pose to our panelists. But we also want to hear what questions you might have today. So please feel free to send those questions as things occur to you as you hear the presentations. And then we'll shift into sort of that Q&A portion of the agenda after we hear from our panelists. So I'd like to just briefly introduce our wonderful panelists today. You already heard from Dr. Tabia Okenchobe, who is a professor at Morehouse School of Medicine and is leading the Georgia CEAL work. You will also hear from Johnnie Thomas, who's a nurse health navigator with Children's Healthcare of Atlanta. You'll hear from Dr. Lilly Immergluck, who is the Director of Pediatric Clinical and Translational Research at Morehouse School of Medicine and a Pediatric Infectious Disease Specialist with Children's Healthcare of Atlanta. And you'll hear from her colleague, Dr. Sadia Kizzer, who may fill in for Dr. Immergluck later in our presentation today. And then finally, you'll hear from Dr. Theresa Jacobs, who is a family physician and director of the Georgia Primary Care Association. So I would love to kick off our panel today with Nurse Johnnie Thomas. Nurse Johnnie is no stranger to the ECE setting. She will tell you a little bit about her own sort of personal and professional experience and reflections over the course of the last year or so. And perhaps she can begin also by telling you a little bit about the work that she does at the Sheltering Arms Educare site as well. So Nurse Johnnie, I will turn it over to you.
Thank you. And good morning, everyone. I am, like you heard, Johnnie Thomas. I'll be honest, when I received this invitation to be a panelist on this conversation about the COVID vaccine, I was honored, but I had to let the folks at GEEARS know that I'm not a vaccine expert. I'm not an MD, PhD, or epidemiologist, or any of those things. I am a registered nurse with Children's Healthcare of Atlanta, and I connect families to healthcare to make sure that their children, their young children, and actually their entire family, that they're healthy and that they are well cared for. I do this work in a larger early learning center where about 200 children under the age of 5 are enrolled. My esteemed colleagues on this panel will give you all of the information you need to make an informed decision about the COVID vaccine. They'll be able to answer your questions and address your concerns that you might have about it. So I have to wonder, what can I give you in this discussion about the COVID vaccine? I figured it might be helpful for me to take a few moments to help you understand why I decided to get vaccinated. I live alone, so I didn't have to worry about bringing COVID home to any of my loved ones. I'm comfortable wearing a mask. I'm in reasonably good health, and my employer did not mandate that we get vaccines. But by the time the vaccine was made available to me in December of last year, I had some major motivation to get the vaccine. And the first two reasons were deeply, deeply personal. In the middle of the pandemic, about a year ago, my mother was unexpectedly hospitalized with concerns about her heart. She passed away 2 days later. without me, my sisters, or my stepdad being able to sit at her bedside. 1 week later, my dear friend, my next door neighbor, died from COVID after a long and difficult hospitalization. And those two losses would have been enough to make me want to roll up my sleeve for the vaccine. But then I realized I had a professional motivation. I had a few more reasons to get vaccinated. Actually, I have over 200 reasons. The children, they were my final motivation to get vaccinated. The parents of the children at our early learning centers and the schools where we work are trusting us not only to educate their children, but to safeguard and protect them while they're in our care. They are the reason why I maintain my nursing license. I get continuing education. I take an annual flu shot. I get CPR recertified. They are why you know first aid, understand their food allergies, and know how to administer their rescue medications. Because my family and I were all vaccinated, we could gather together to celebrate Easter, Juneteenth, Father's Day, Memorial Day, and the 4th. And I don't want to take those types of celebrations away from the families of the children that I serve because I wouldn't get vaccinated. I work in early care and learning. I have a duty to care. And so I'm vaccinated. Thank you. Thank you for letting me share.
Nurse Johnnie, thank you so much for sharing your very thoughtful and personal reflections with this group. We really appreciate all of the work that you do, and especially your candor with us here today. Thank you. So our next panelist is Dr. Lilly Immergluck, and I believe Dr. Immergluck has a presentation that she's going to share, and I'm hoping that she'll be able to share her screen so that we can kick off that portion of the presentation. As I mentioned before, Dr. Immergluck brings really a range of expertise to this conversation, and I know that she's going to share a lot of information, both through her expertise in pediatrics and as it relates to vaccine trials. So I will turn it over to her, and she should feel free to reintroduce herself to include any relevant details that I may have left out, and go ahead and start her presentation. So Dr. Immergluck, the floor is yours.
Thank you. And first of all, thank you for the opportunity to speak with you all today about this important topic and address this. I'm going to give you a whirlwind because I know 10 minutes. Can you all hear me?
We can hear you okay. There's perhaps a little bit of a connection issue.
Okay. Okay, but you can see my screen, correct?
Yes, we can see your screen.
Okay, I'm going to keep on going. All right, so I'm going to give you the perspective of a pediatrician, person who also specializes in pediatric infectious diseases, as well as a primary care physician, and also someone who does. So I would like for us to kind of get centered on the fact that the data I share with you may be changing. So because we're still in this pandemic, it's an evolving process, and we have to kind of move and how we think about this with that process. So the data is changing because you have all heard in the news about the COVID variants that are circulating in our communities and how that's also changing. The vaccination rates are changing for the adult population, and currently also for the vaccination rates among children. So the thing to remember about all this is that COVID-19 vaccination of adults and children right now could also impact the incidence of COVID-19 infections in the US, as young children, those who are under 12, those who are not vaccinated, comprise a greater proportion of the population who are at risk to develop disease. Okay, this is a really quick snapshot of as of July 8th, the COVID-19 cases, and you can see where Georgia falls in that spectrum. We're in the darkest shade of blue, and that's because we are in that greater than 100,000 cases of our population in our state. This is an important slide to share because it goes back to emphasize the point I made earlier about the variants. I showed and did a slide presentation in June, And that's a left-hand set of bars. The alpha variant, or otherwise maybe more commonly known as the UK variant, was comprising about 70% of the variants that were circulating that we were testing. The Delta variant, the variant that was originating in India, comprised a little bit under 30%. And now, just a few weeks later, as of July 3rd, we are in a much different situation. The Delta variant has, of all the variants that have been sequenced, comprises over 50% of the variants that we are seeing. And then the UK is a smaller percentage. In Georgia right now, we don't see the Delta variant in the rates that you're seeing right now on this screen. I'm going to go and talk a little bit about epidemiology because I really want us to understand what is the situation for children, since many of us take care of children, educate children. So right now, children make up about 22% of the US population. Okay, so let's talk about 73 million kids. And our overall rate is about 5,400 per 100,000 children in the US population that are infected. So when you think about this, the cumulative rates of SARS-CoV-2 infection among kids who are symptomatic in this age of 5 to 17 years, we are seeing comparable levels of infection in terms of symptomatic disease as we were seeing in adults 18 to 49. And in fact, higher rates than adults who are over the age of 50. So children and adolescents would also, from this, and as we've learned more and more with them since the beginning of this pandemic, can transmit SARS-CoV-2 infection. And we have to bear that in mind as we decide about what's the best mitigation strategy, prevention strategies for transmission and spread of COVID-19. As of July 8th, over 4 million children have tested positive for COVID-19. Now, I think this is probably an underestimate because we don't test as widely, especially of our pediatric population, but this is a good reflection of where we probably stand. And about 19,500 child cases were added to the cumulative total just this past week. So there's a National Center for Health Statistics, and we monitor this. And again, I think that this is probably underreporting, but the point is to emphasize that deaths do occur in children, and deaths do actually occur in young children. It's a quick little bar graph of all the states across the US and shows you the number of child cases as of July 8th, 2021. And you can see where Georgia falls by that red arrow. So we're not the worst in terms of numbers, but we're not the best either. I'm going to shift quickly over to clinical pre-COVID because I think that I don't want to say the news media, but the sound bites you hear, they don't talk a lot about the pediatric situation. And I would like to emphasize that children do get sick from COVID, but certainly compared with adults, children and adolescents who are infected with SARS-CoV-2 are more commonly asymptomatic. In other words, they're infected, but they don't necessarily develop the symptoms, or they have mild symptoms, right? The problem is we don't know who, just like in adults, we don't know who actually goes into the moderate to severe disease. And the other issue that comes up and is becoming more and more of an issue is what we call long haul syndrome. These are the consequences of infection that's not right up there in front of us in terms of at the time of illness, but may occur after people recover. Because again, we don't know as much as we'd like to know about being infected by a novel coronavirus. And the last thing, and I think this is really important to emphasize, is disparities exist in children, just like adults, okay? In terms of those who are hospitalized, those who are in the ICU, those who are dying, there are clear disparities so that we see higher proportions of our Hispanic or Latino population as well as our Black or African Americans. One condition I'm just going to emphasize really briefly, not go into all of this data on it, is this multi-system inflammatory syndrome. And it is related to the type of germ that's causing the infection and our body's response to that. Okay, so these are often people who recover from their infection and then later on down the road, they develop this condition. It's called multi-system inflammatory syndrome because it affects multiple organs. And the kids who are seen infected by this, for the most part, who develop this condition, are really people who are a little bit in the older age group. We see a little bit of predominance over males over females. And again, we see some disparities that occur. This is an example of some of the symptoms that we might see in children who present with MISC syndrome. Now I'm going to pivot over to vaccinations, and because I do want to be mindful of the time allowed. As of July 4th, we see that approximately 55% of those who are over the age of 12 have been fully vaccinated. So that's a really good news to me. The thing about me, and for me right now as a researcher and as a pediatrician, is I'm looking at what's happening to the people who are younger than age of 12. So as we all sit around and think about what are we going to do in the fall, what are we going to do as far as thinking how to best protect our children, I would like to just pose these last two slides in terms of consideration of developing policies. A lot of this is based on what the guidance that's been updated from CDC and also the American Academy of Pediatrics. And really, we have to remember that transmission of SARS-CoV-2 in schools and other educational center programs really hinge on local transmission rates, the types of variants that are circulating, which is changing, so we have to keep up with that. The epidemiology of COVID-19 infections among children, adolescents, and the people who will be taking care of them, whether that's teachers, whether that's staff in a childcare setting. Vaccination coverage. If you live in a highly vaccination coverage area, that's a different story than somebody living in a lower vaccination coverage area. Schools should consider levels of community transmission always as they think about what are their mitigation strategies. There's this thing called layered prevention strategy, and I kind of outlined the highlights of a layered prevention strategy. And whether you're on a board or you're part of a conversation to develop policy, I would like you to kind of keep these things in mind because, again, depending on your community, the layered prevention strategy and what elements of that you want to take and implement are important. So that's including promoting vaccination, the proper use of masking and when that's going to occur, physical distancing, screening. I think that as vaccination goes up, less and less screening is occurring because people feel more comfortable, right? But again, depending on your community, what cadence of screening do you want to implement? Since we just said that many children and adults actually are asymptomatic or mildly symptomatic. And then the usual hand washing, respiratory etiquette, we know that already. And then again, how our environment is, what's the ventilation situation as we enter into like the winter months of this year. I'm going to end on just saying that the vaccines work, okay? They're not 100%, none of them are 100%. The efficacy are going to change with the variants changing. The effectiveness, only time can tell as we roll through this pandemic. And my hope is that we can beat it. We can beat the variants that are coming out. And then I'll end on this note. Thank you.
Thank you so much, Dr. Immergluck, for that very thorough presentation. I've already seen some great questions coming in through the chat that I know we'll be able to incorporate into our Q&A session. At this point, I'd love to turn it over to Dr. Jacobs, who is a family physician, and she's going to pick up the conversation perhaps where Dr. Immergluck left it off. And I know that she'll have some compelling information for us to consider. So Dr. Jacobs, the floor is yours.
All right, I moved closer to my Wi-Fi connection because it seemed like I was going in and out. But thank you so much for having me here. I'll just speak just a little bit. I love that Dr. Immergluck's presentation. It was absolutely wonderful. What I've found myself doing since last year is basically having these town hall meetings and answering the questions that all of the patients have. And it doesn't really matter how old the patient is. I get the same questions from 13, 14-year-olds that I get from 60, 67, even 80-year-olds. They're always the exact same questions. Do you think that the vaccines were made too quickly, Dr. Jacobs? They rushed it out. And we now know that that's not true. Those messenger RNA vaccines like Pfizer and Moderna, they've been working on that platform for over 30 years. Well, I heard, Dr. Jacobs, it causes infertility. No, there's no study that has proven that it causes infertility. Does it cause the blood clots? And does it cause Bell's palsy? And so there's been no direct correlation with those diseases with these vaccines, but out of an abundance of care, the CDC and the FDA have released some recommendations when it comes to people that are at an increased risk for those particular diseases. So social media is one of the big things that I have to fight almost every single day. I get a question almost every single day from someone that read something or heard something on social media. Well, Dr. Jacobs, there's this doctor who says she's an OBGYN, and she says that she's got this 30-minute video talking about how the vaccines will change my DNA. And then the government will be able to track me every place I go. And, so usually I tell them, we're not that good. We have not developed science where we can, that's a great idea, right? And for some, but we're just not that good. And so are these vaccines able to track you and they can trace you every place you go, alter your DNA some sort of way? Absolutely not. And so same questions. Every group that I get, well, I heard, that people are dying after they get the vaccine because they've gotten the virus itself. So I thought that, once you get the vaccine that you won't get the vaccine. No, that's misinformation again. What we all know that there's nothing 100%, as our previous speaker just spoke about, nothing 100%, but what's a guarantee is that moderate to severe disease, almost 100% effective against that. So you will not die from this disease if you've been fully vaccinated. The football coach who was diagnosed with the virus, he is fully vaccinated, but he touts that the fact that he's been fully vaccinated is why he's not on a ventilator, why he's not in that ICU. And so that's the message that we have to get out to folks, that once you're fully vaccinated, then not only do you protect yourselves, but you also protect others. You protect these precious little babies that are 1, 2, 3, 4 years old that are not able to get vaccinated. Look at the children that have sickle cell, these kids that have asthma, these little kids that have asthma. There's some undiagnosed cancer in some of these children, unfortunately. So the question I always ask folks at the end of every presentation, who do you love enough to want to protect? Who do you love enough that you want them to stay here? And my God, you don't want to be responsible for giving them a disease that checks them out of here. I have 2 aunts that passed earlier last year from COVID. Love them dearly. My brother and his wife were admitted into the hospital at Christmas time at the same time, suffering from COVID complications. Another cousin, 77 years old, in the ICU for over 2 weeks and didn't know who she was. Had to learn how to walk, how to talk all over again. Still dealing with long hauler syndrome with her brain function. And so vaccines, none of the vaccines do that, right? They protect you from that. So a lot of times when folks are talking about the negative things that vaccines do, what about the 600 plus folks that have died from COVID? Is that not negative enough for you to consider getting a vaccine? And so my 77-year-old cousin tells me that anytime I do this talk, please bring her up. Did she get vaccinated earlier this year? She absolutely did. Did she have chills? Did she have some muscle aches? Did she have fatigue? She did. But the message she told me to tell everyone else, that lasted for 2.5 days. She was in the hospital for over 30 days from COVID and still suffering from some of the symptoms from COVID disease. And so you weigh that out, 48 hours, 72 hours, a little fatigue, a little muscle aches, but I can take a little Motrin or Tylenol to help me get through that. I got vaccinated. My entire family is vaccinated. I have a sister with stage 4 cancer who's vaccinated. God forbid, I've been flying every single month up to Michigan to see her for the last year and a half. We're getting ready to celebrate her 52nd birthday on next Wednesday, a birthday that we never thought that she would be able to see, but I loved her enough to want to get vaccinated. My daughter loves her enough to where she got vaccinated at 36. Her 18-year-old and her 22-year-old sons love her enough till they all got vaccinated. Her husband loves her enough till they got vaccinated. Her ex-husband still loves her enough, even though he's the ex, he got vaccinated. So I'm gonna leave this right here. I'll stop right here. But my question to everybody is, who do you love enough to want to protect and want them to stay here? And I'll stop there.
Dr. Jacobs, thank you so much for sharing your perspective, not only as a family physician, but also as a sister or a daughter or a niece or a friend. We really appreciate you sharing your story with us today. And I know many of the questions you said you get asked at every single town hall are on my list to ask later. So you might be answering some of those questions again. Thank you so much, Dr. Jacobs. Next, I'd like to turn it back over to Dr. Akintobi to provide a little more context and perhaps some resources that you all might be consulting now and into the future and sharing with others. So I'll turn it back over to you.
Thank you so much, Dr. Goldberg. And you all, please give me a sign if you cannot hear me. Wonderful. Thank you for the thumbs up. So maybe I can just start, since we're on whys, and hopefully you can see my screen here. My why, beyond really serving and leading to bring folks like the panelists on today, as well as you, to hear a bit more facts, as well as the importance of your leadership, is that my brother had twin boys back in March. And I also have another nephew who's 3 years old. And so before I could hug on them and kiss them, I needed to make sure that I was vaccinated. I have an 18-year-old and a 13-year-old. And I also wanted, even before things opened up and they were able to get vaccinated, my husband and I had to make the decision to be vaccinated. I have two 70-year-old parents who we've not seen in a while. We saw them for the first time in May. And we were on different sides of the fence, even in our household, meaning our broader extended household in terms of getting vaccinated. And before I could tell them to do it, I had to model it and show them that I didn't grow a third arm and all would be well. And they did it also for their brand new grandkids. So it's personal for us. And of course it is also professional, right? So now what? Many of you are on to learn more. Some of you who are on are vaccinated and others might be on the bubble. And many of you really are not yet confident or maybe hesitant in thinking about the vaccine. But wherever you are, we want to give you resources that you can use, both for yourself as you think about your why, but also as you think about having conversations and answering some of the questions like Dr. Jacobs answered, as well as some of the science and facts that Dr. Immergluck shared. So Georgia CEAL, as you might start to understand, we want to understand where people are. That's why we want your questions to come in with respect to the things that contribute to COVID, but also we want to establish effective community engaged outreach and response. And we think for Georgia, all communities are different. You are a unique community when we think about our babies and those who are most vulnerable. And so your leadership as a community of practice is one that we care about. So please, again, do let me know if you have challenges hearing me, and we'll pivot as soon as possible. So I want to put this number up front. I know you're seeing this for the first time. So I'm going to ask Brittany Taylor, who's a project director working alongside me for Georgia CEAL, to include this information in the chat. We want to serve you and do things like this with the communities that you serve, whether it's your church, whether it is your early learning center. You can see the number there as well as the email. So that number is what you see in the chat for ways that we can collaborate with you to do things like this and also get vaccinations to you. And so another important resource is the National COVID Resilience Network. And I put resilience twice, right? So you can see both the email as well as the website there. Morehouse leads also a national network designed to help us to recover related to COVID. And so as you think about your why and the places where you live and lead, whether it's your household or as an early child care provider or others, you can go there to find resources like fact sheets, videos, and other tools you can use that are science-based and based on the types of questions that people are asking. And so you can certainly email us to get those fact sheets on whatever topic. And then also we have, I think now, 18 languages at this website that includes up-to-date new COVID resources, including where is the latest place if you put in your zip code or county to get the vaccine, to get tested, or even where you can find mental health resources. We know all the things that were there before, you know, whether it was workforce development, people needing to have access to potential jobs, mental and behavioral health, clinical services, whether you have insurance or not. This particular website that we'll put in the chat can help you to know where in Georgia, and you can share this with your family and friends. It's a national resource that's updated regularly on where to get the vaccine, where to get tested, and even to know, based on where you live, where the COVID hotspots are. And then, as you can see here, they're location-based resources. Plug in your zip code, plug in your address, and all the testing sites, pharmacies, which really are the places now where you can quickly schedule a vaccine, where you can go and do that and share that with friends, family, and other providers that you care about or who you collaborate with. Sorry for that noise, you all. Life is happening. My cats just push something over and I can't mute it. So educational resources, myths, facts, etc. So we want to give you education, but also ways to take action, where you can get the vaccine and share information with those you care about. And then we know not everyone is necessarily on the internet or has an email. People have a question, they can call this number 1-877-904-5097. And in any language they need, they can call and ask a question and be linked to services. So again, we are a collaboration to serve you. Our number is 404-752-1700 or georgiaceal@msm.edu. I look forward to our conversation now. Dr. Goldberg, let's do it.
Great. Thank you so much, and thank you for sharing those resources with our group today. We have a very, very long list of questions that I am eager to start asking our panelists. Some of them have been coming through during our conversation today, and some of them you all have, and some of your peers have submitted to us previously. And so I think that there are some sort of general questions about the vaccine, and that might be a good place to start. So we did get some questions sort of generally about how the vaccine actually functions and what it does inside of the body and how long we might expect to experience that impact or any side effects from being vaccinated. So I will allow any of our panelists to sort of take that one if they'd like to share a little bit of detail about what we know.
All right, if nobody else is going to jump in, I guess I'll jump in. Basically, what the vaccines are meant to do, they are, depending on if it's a messenger RNA or if it's the J&J vaccine, they basically are programmed or designed to do the same thing, meaning that once the vaccine is injected into the body, then the body looks at it and responds and makes antibodies against that particular virus. So those antibodies are produced so that the body, when it does actually encounters COVID, the virus itself, there'll be antibodies there that will recognize it as the enemy and will go about and destroy it so that it doesn't grab hold to the body and cause detrimental harm to you. And so these antibodies and you know, those Pfizer and Moderna vaccines, there are 2 dosages. So there's a small increase in antibodies for the first dose. And then with the second dose, there's a bigger response. So there are more antibodies that will come out. And their job is to protect you against that disease. And as the statistics say, that they are really good at protecting you from moderate to severe disease where you're not hospitalized, being on a vent, and death. So they're really good at doing that, even with the Delta variant. Which I think is absolutely wonderful. Now, as far as how long the antibodies will last, that's a question that's really still being studied, because I know that a lot of folks have heard about Pfizer kind of saying that they think that you're going to need a booster shot 6 to 12 months. Well, that data has not really panned out quite yet, so they're still looking at that. But will we need a booster shot? They're still looking at the data to make that decision. So what's my personal thoughts about it? We probably will, and maybe a year or so after the initial dosage, just like we do with that flu vaccine. But they're still looking at the data, weighing it out to see when we will actually need a booster shot. But the data shows that we're well protected after 6 months, even up to 12 months now. It appears as if we still have some protection as well. And so now they're looking at that data from 12 months out to 18 months to 24 months to see if those antibodies are still at the point where it can protect us. So that's a question that they're still looking at. And once the data is completely out, then we'll be able to answer that question more appropriately.
Great. Thank you so much, Dr. Jacobs. All right, we are getting a number of questions about folks who may be vaccinated and may perhaps have COVID, contract COVID, but be asymptomatic, right? So not experiencing any active symptoms and perhaps unknowingly be transmitting to those around them. And so trying to sort of navigate this new territory as either parents or caregivers of young children, you know, how would you advise that we navigate this? One attendee asked, you know, whether they should still be, you know, wearing a mask around their children, if their children perhaps are more susceptible. So wondering if one of you can speak to that piece and how we can navigate this sort of new space that we find ourselves in.
Yes, I can answer that or try to answer that. It is, I know the CDC came up with the guideline, of course, that if you are vaccinated, the fully vaccinated people can be in a room or in an area without the masks, which is exactly correct. The thing is with the vaccines is that we have not yet come up with the studies. There are studies going on which are checking on the transmission after being vaccinated. So we do not know yet if once you're vaccinated, are you able to transmit or not transmit? So there are studies going on. We do not have the results yet. You can still get that disease, right? Even if you are vaccinated, everyone knows that. You can get the mild disease. So that means you can get the vaccine. You can get the virus in your nose or in your respiratory system. So that means you can transmit it as well. That's why even if you are vaccinated, as in if you have an immunocompromised subject at home, if you have a loved one who is sick or who can catch the disease, or just older person or a child, whoever you think might be more susceptible, we would recommend that you wear mask when you are outdoors, because you do not know who is vaccinated or who is not vaccinated outside, who is just transmitting it asymptomatically. It's your choice, it's up to you. But yes, if the pediatrician right now is saying that your child may get the disease from you when you are outside without the mask, it is a possibility. But we are not sure yet, but that is what it looks like at this point in time, until we get actually the results from the transmission studies.
Great, thank you so much, Dr. Kizzer. Dr. Immergluck's presentation included a number of recommendations that might be appropriate for K-12 settings. And many of the folks on this call work in birth through 5 settings where, very young children, for example, can't even wear a mask. And, as perhaps older children are eligible to receive the vaccine, we know our youngest children will be last on that list. And so we have received some questions, particularly as guidance has shifted, what can they continue to do to protect their own staff and their own children and the children who are in their care? And what might that look like in sort of an early childhood setting? And would that look any different than it would in a K-12 setting?
So I think for those children, the best thing would be if you can navigate to the CDC has an extensive list of what needs to be done for K through 5. I know CDC is not the most user-friendly site to navigate, but if you go to their site, they have all those policies in place. But the main thing is just like, and those are like simple common sense things that we should be teaching our kids, and we probably are. The hand washing and cleanliness. I know the kids are going to play and doing that, but just like implementing it more. And I think in the last 1.5 years or so, these kids, like K to 5, they have learned more of these hygiene habits, being at home and being in the pandemic. So reinforcing those habits more, hand washing, hand hygiene, staying social distancing as much as possible, which of course, I totally understand. In real world, it's easier said than done, but we can only do as much as we can be done. And for the staff, the main thing is for them to be vaccinated, right? That is the main thing for the staff, which I personally would promote. I mean, I cannot mandate it or anything like that. Well, even the state is not doing it, but like all the speakers have said, and I would just say, get vaccinated. If you can get vaccinated, because that is the best way for you at this time to protect anyone. That is any loved one, anyone you care about, and in the K to 5, along with the layered protection, like hygiene, hand washing, and cleanliness that we are already taking care of. The schools are doing, cleaning up the, and we have learned a lot more, like all the scare that was before, that it transmits from the surfaces and all that. It is not as much as it was before. It's more through the person-to-person transmission. So the social distancing and is more important, and the hand hygiene, along with vaccination. That is what I will promote the most at this time. And of course, CDC guidelines, if you want to get into more details, is what you can follow.
Thank you, Dr. Kizzer. I do see a question here about individuals who may have already been infected with COVID-19 and are wondering whether they have protection against contracting it again, and whether they should still get vaccinated if they have some level of protection conferred by already having been infected.
So, sorry, does anyone else want to take it?
I can take it if you want me to.
Okay, sure, but I don't want to keep holding it.
So those studies are out for those that have had COVID and they've been checking their antibodies. So it looks like they may have some natural immunity, maybe up to about 90 days or so. Having said that, what are CDC's recommendations about them getting vaccinated? It says they should get vaccinated because that natural immunity doesn't last long. So maybe up to 90 days. So I've got a good friend who's had COVID 3 times. And right, she's, you know, cleared it, got better, had got it again, a different strain. And so can you get it again? You absolutely can. And so the CDC's latest recommendations are, because those studies are extremely clear, natural immunity does not last very long. And so after about 90 days or so, you should be thinking about getting vaccinated.
Thank you, Dr. Jacobs. And this may be another question that you could take a stab at. And it's something that you mentioned before when you were talking about boosters, but folks are wondering if this might look like the flu has historically, where we might need to be getting, you know, a shot every year to protect ourselves against COVID. Can you speak to how you think that might play out? I know you can't predict the future, but what your thoughts are on sort of recurring vaccination?
Yeah, if it behaves like the typical virus, yeah, I think more than likely we're going to have a booster. The thing that we're waiting to find out, when is it going to be 12 months, 18 months, 24 months? Like I said, with the flu vaccine, we do that one every month. They tweak it every single year to help include additional strains, because viruses do what they do. They want to survive, and in order to survive, they're able, and I think this is amazing, this is the little nerdy part of me, that they are able to change their genetic material, you know, to be more virulent so that they can continue to live. They live through unvaccinated individuals, believe it or not. That's how they continue to replicate. And so COVID is only doing what viruses do. But I think that there's going to be a booster shot required, but we're waiting for the data or the science, the studies to come out to tell us at what point. We know it's past 6 months. So now we're at a year, at 12 months, seeing is it going to be 12 months? Is it going to be 18 months? There was some indication that may be up to 24 months, but we will certainly see, because the data, they're studying that every single day. So we hopefully in the fall, we'll have an answer to that particular question.
Dr. Goldberg, may I just add something to what Dr. Jacobs shared, and just so appreciate all of the panelists on this. One of the facts that we know is so, as of this past Friday, is that well over 99% of the people who don't get COVID are those that are vaccinated, right? What we know is that 0.0004% of people who have gotten COVID are also vaccinated. So that means that there is obvious safety and protection with the choice to get vaccinated, right? So that is the fact, right? We know that there's no vaccine that is 100% effective. So that means the flu vaccine, that means all of the other vaccines that we have encouraged our children and that we ourselves take. But getting vaccinated against COVID decreases your chance of being hospitalized. It makes severe and even moderate, severe COVID experience less. And you are not going to die from COVID if you get the vaccine. So when we think about weighing the odds, these are the facts. And so we hope as you think about your decision that you will think about the reality of the facts related to getting vaccinated or not. Just wanted to throw that tidbit in there as we can continue the conversation.
Thank you for that. I am seeing some questions here come in around potential long-term effects of the vaccine, of receiving the vaccine. And I'm wondering if anybody would like to speak to that specifically. I know Dr. Jacobs alluded to it during her presentation, but a number of questions regarding, you know, what we might not know or what the long-term effects might look like.
We've got some really great data when it comes to all the vaccines that we have out here. And rarely is there something that occurs years later from a vaccine. So we know that. And the science now, when we make vaccines, and that's the other thing I want to just mention, that we are at a point now that we no longer should wait 5-10 years to get a vaccine out. The science is just great. The studies have been going on, so we no longer have to wait years and years and years to get a vaccine out and pushed out to the public. So the science is just that good. So the science is also at the point now where the ingredients that are inside a vaccine now, they've learned how to preserve that vaccine to get it into the arm, but those products in there now dissipate or they're eliminated from the body immediately. So we no longer have things, we no longer put metals and other type of products in vaccines because we've learned not to do that. And so the science has advanced to the point where we're pretty good at putting together a vaccine now. We are pretty good at it. And we're really good at creating vaccines now that will not cause us long-term effects as a result of the vaccine itself. So the science is there. It's much better than what it used to be. I know folks can cite some other vaccines in the past about what it did, long-term with some patients, but the science now is at a point where we no longer should have that problem. And the other thing that I like to say as well is that vaccines are, the safety data is what they call peer reviewed, meaning that there are multiple groups that are not connected, that are not funded by the same organizations, that investigate and research these vaccines so that we can make sure that it's balanced and that the information that's coming out is not biased in any kind of way. And so we're at that point now where you will see multiple different research groups that are not connected, not funded by the same organizations, and they're getting the same data that's out. That way you know that you've got a good product, you've got a good vaccine, a good medication that's coming out to the public. So long term, it is so rare, and recently in the last several years there are no vaccines that have had long-term effects that have been produced in the last several years, which I think that's great data. I think that we're doing really good in that area.
Thank you, Dr. Jacobs. Just as a quick follow-up, I know you mentioned this during your initial presentation. We did receive some questions about the potential impact on fertility and the long-term effects on the reproductive system. Is that something that you or one of your colleagues might be willing to address?
Yeah, that's a question that I get asked all the time. And I saw another question that said, well, this talk seems to be lopsided. You guys are only talking about the vaccine. Well, I think our job is to make sure that when you make a decision about getting a vaccine or not getting a vaccine, you make an informed decision that is not based on myths. It's not based on something that was put out on social media. And this infertility myth is one of the ones that folks it just got out in the public that, it causes infertility. These vaccines do not do that. It's been peer reviewed by several different groups. It does not cause infertility. And and while we're talking, believe it or not, they found that pregnant women that have gotten vaccinated passes on passive immunity to the unborn child. I think that is fantastic. If they breastfeed that same child and they've been vaccinated, believe it or not, they pass on passive immunity to the baby that they're breastfeeding. So that's data that we need to put out on social media. It does not cause infertility at all. They've proven that in multiple studies. And just before I stop, I'm going to say this, and Dr. Akintobi know that I like to tell folks this because this is not put on social media, that men that get COVID, the virus itself, have a 6-fold increased risk of getting erectile dysfunction. Now, that's something you don't see on social media, that you don't hear anybody talking about that, but men that suffer, that have been infected with COVID, 6-fold increase of erectile dysfunction. And that's something I think that we need to talk about and make sure folks understand. COVID is a horrible virus. It's a horrible disease. It causes long-term effects in many individuals. And so that's something we're trying to protect everybody against, because we don't want folks years down the road to still be saying they're having issues from the virus itself. And so that's why we're doing this presentation. And that's why, you know, still wearing a mask, washing your hand, social distancing, being vaccinated, those are all ways to combat this disease.
Thank you, Dr. Jacobs. I'd like to shift gears a little bit, as we have received a couple of questions regarding the possibility of vaccine mandates. And I recognize that this may be a little bit as more of a policy question and maybe outside of the realm of your expertise on this panel, but wondering, you know, perhaps if you see a place where there may be movement towards a mandate, whether it's for adults or children, and what that might look like. If anyone can, feel free to take a stab at this one.
Well, this is another one of those questions that they ask, because I work at a community health center, and they were asking, all the employees asked, are you guys going to mandate us, make us take this vaccine? You know, there are some places that demand that you take that flu vaccine. If I'm working in a healthcare facility, they demanded that we have that series of hepatitis B, and it's a condition of employment. And so if I don't get that flu vaccine, or if I don't get that, I didn't have the Hep B series, they wouldn't hire me. So when we talk about mandates, are there some organizations, some healthcare facilities that are going to, and has already mandated this COVID vaccine, but a mandate where they come to your house and make you take a vaccine, that's not something that's going to occur. But if you want to take a cruise, you're more than likely going to have to be vaccinated, and you're going to have to show proof if you're going to take a cruise. If you're going to travel out of the country to certain other countries, you're going to be mandated. Just like my daughter took a mission trip to Peru, she had to have yellow fever and a bunch of other vaccines. It was mandated for her in order for her to go to Peru. So are there going to be countries that are going to mandate it? Absolutely. Here in the United States, are there going to be employers that are going to mandate it? More than likely, and some have already began to do that. But it's still going to be your choice as to whether or not you want to take that vaccine.
Thank you, Dr. Jacobs. As a bit of a follow-up to that, we have received some questions about requiring vaccines in school systems or in childcare. And again, I recognize this may require some of you to either step outside your realm of expertise or look into your crystal ball. But do any of you have any thoughts on when or if that might become sort of part of the requirement, along with, you know, a long list of other vaccinations?
Oh, she's not jumping in. But all right, so you guys know this is one of my little pet projects that I just love talking about COVID, because I get a lot of questions about it all the time. And so, you know, are there mandates of vaccines now prior to COVID to go to school? It is, right? To go to college. I got college kids that come to me all the time, needing that meningitis vaccine. And some schools will allow you to have a religious exemption or a medical exemption. So will that eventually roll into our public schools? More than likely, yes. Probably once these vaccines get full approval, they will more than likely be something that the school systems will require. Some schools now are, especially some colleges, are already requiring the students to be vaccinated on campus. So that's a given, or they given the option of doing virtual learning as opposed to coming on campus. They're not going to allow them to stay in the dorm. They will have to be at home and do virtual learning. But so is it going to be mandated? My guess will be, yeah, just like many of the other vaccines are already mandated with some exemptions.
Some of the things that we're following as a part of the SEAL network is exactly related to the question that that came in. Some of the pace related to the mandates has to do with whether the organization is public or whether they're private, specifically related to schools. So I think as the data and the reality changes, Dr. Goldberg and Dr. Jacobs and others, it may call for us to have a discussion like this again. Because just like we were in a very different place in January when, you know, vaccination and who was able to get it was different, certainly come this fall and even into the winter, things will evolve. And so as the science and the reality evolves, I think that discussions like this will need to continue. But definitely a big piece of that is whether the school or the organization is public or private. And of course, that changes people's comfort level and what they can opt to do or not. So we look forward to continuing these discussions because it's continuing to change. We're in an evolving era.
Yes, I think you're right, and that we will likely be asking similar questions in months and years to come. I did want to shift now to some questions specifically about children. Not surprisingly, given the population that's on this call, we have a number of questions regarding children, including when children under 12 will be able to be vaccinated and what that likely timeline looks like. I'm wondering if anybody can address that question.
Yes, so currently there are a few vaccines that are under trial for children specifically under 12 years of age. We have at least 3 that I know of that are working. So, but like everything else, we do not know the exact timeline for that. They are rushed like these ones. There will be a timeline for them to be tested. They are still in earlier phase. There will be a main phase 3, which is basically in which they are tested in a bigger population of children, and then they will go to FDA, and then the FDA will approve it, and then it will be given. So I cannot give you a timeline dependent on that, but I can say that they have started working on those trials, and they are in progress. So.
Thank you, Dr. Kizzer. There were some questions specifically about our very young children, about infants and toddlers, and whether they're being included in the clinical trials and whether they will also be eligible for the vaccine.
Yes, so there is definitely 2 trials in which they are actually testing 6 months and above. So they have 3 arms in which they are testing 6 months to 2 years, 2 years to 6 years, and then 6 to 12. So there are vaccines that are having trials.
Thank you. I do have a rather specific question here that is not necessarily specifically related to children or the vaccine itself, but about rapid testing and the availability of over-the-counter rapid tests, and whether those will become more readily available and might be useful in settings where adults are working with more vulnerable populations, including children who aren't eligible for the vaccine. I don't know if anybody would like to take that one.
I personally do not know about the rapid test over here, Dr. Jacobs, if you know about it. But I know about that there are definitely rapid tests that are being done internationally at the airports when we take off, and those governments are taking them in consideration. So they are definitely a thing that we are moving to in future. Dr. Jacobs, if you can say the ones about here.
Yeah, because there's some available already, and I want to say you can get one of them on Amazon, but they are available now. There's a couple of different manufacturers that are making them available. I suspect by fall there's going to be a lot more out there on the market. There are going to be some better than the others, and so research is currently going on now to weigh out the sensitivity and the specificities of those rapid tests that they're going to make available for home use. So, but there are some that are now already available for home use now.
And I would just add, and I'll put in the chat, another initiative that we're working on to really promote COVID testing in tandem with people considering the vaccine. Again, vaccination decreases by more than 99% your likelihood of getting COVID, but you still can get it, and you still need to know your status. And for us as a state and as a nation to really know the effectiveness of what we're doing in terms of vaccines, people still need to get tested. And so we want to really emphasize that as well. So I'm going to put that information in the chat. There's a great opportunity for those of you who are really interested in learning more about the effectiveness of types of tests. We're doing some great work in rural and urban Georgia that can give you more information. So we'll share that information with you as well. Testing is still important, just as vaccinations or your consideration of the vaccine.
Thank you for sharing those resources with the group. I did want to go back to a question that I think we've addressed, but might be worth revisiting around, this notion of layered protection, especially for children and those who may not be vaccinated, around mask wearing and sort of how effective masks are in a setting like childcare, and why they might or might not be part of the solution looking forward to the next couple of months as things are starting to shift. So would anybody like to speak to that? There were some questions about specifically about mask wearing in childcare settings.
I mean, masks are important. They are one of very, very basic thing to have in this pandemic. And for children who are not who cannot be vaccinated at this time, even though they get milder disease, I mean, masks and social distancing and hand hygiene, these three things are the main things that are going to prevent you from getting the disease. So yes, masks are important. And I have seen children wearing masks. I know they say it's hard, and I'm amazed and surprised by the number of children I see wearing masks without taking them off. I don't have any younger children at home anymore, but I have seen in the supermarkets and at Walmart and at Target that I have seen very small kids have masks on without taking them off, and at the pediatrician office. So I think kids have gotten used to it. In Japan, there are children who wear masks anyway, in the transportation and while commuting. So I do understand it's hard for children to be wearing masks all the time while playing or something like that. But yes, definitely, if if they are wearing masks, putting the mask on, that is one of the main things to combat this pandemic. Dr. Jacobs, anything to add?
Yeah, I agree. There have been studies in other countries where school-age kids, younger kids, wear masks and they practice social distancing and hand washing, and it's very effective, very effective. My little 6-year-old goddaughter, we went out to a restaurant, and you couldn't get her out the car without her mask. She said, no, auntie, mask. And then when we took her to the restroom, I mean, she's 6 years old, and she washed her hands better than any surgeon that she was all, no, you got to do all up here. And she had a little song that she was singing. So it's something that I can tell that her parents, ingrained in her, and she practiced, and she couldn't wait to show me that, she could wear a mask, and she knew how to wash her hands and the whole 9 yards. So it's something I think that if we kind of make it a game, make the mask kind of fun for them as well, I think that we can teach, 3, 4, 5-year-olds, 6-year-olds how to wear masks and even how to wash their hands appropriately. So, but it is still one of the best defenses, wearing that mask, washing your hands, that we have outside of that vaccine for our younger children.
And Dr. Jacobs, we've been back in session at the school where I sit since June of last year, and we have 3-year-olds who can completely correctly put on their mask, put it in place, and wear it for much of the day, with the exception of when they go outside to play. I have some 2-year-olds that want to wear masks because they've seen it modeled by their teachers, by their parents, and by older siblings. So we've heard a lot of that pushback, oh, a child can't do it. I have personally seen a 3-year-old put her own mask on and wear it faithfully every day.
Thank you, Nurse Johnnie. I was going to ask if you might want to share what you've observed since you spend so much time in an early learning setting. So thank you for sharing that with us. I think at this point, we have received so many questions. I know we've spent a while talking about them with you all. this morning. I think I'd like to go ahead and shift to the final portion of our program, and certainly assure you all that there will be more opportunities to ask questions and to find resources. In fact, that is one of the questions that we received is there's so much information out there, and even among sources that seem reputable to me, I struggle to find them. So can you help me find reliable resources, and where can I go? And so I know Dr. Akintobi is going to talk about that shortly. But before we do that, I just want to take a few moments to thank our panelists today. Part of our surveying effort, when we asked childcare staff who they wanted to hear from, they identified really the folks who are on this panel. They wanted to hear from doctors. They wanted to hear from researchers. They wanted to hear from folks who spend time in early childhood settings and understand the needs of very young children. And so that was really the impetus for bringing you all together here today. And we really have benefited from your collective expertise. So thanks to each of you, and of course to Dr. Immergluck, so I know had to leave a little bit early. So I hope everybody will join me in thanking you so much for being here. And thank you also to our attendees. We really appreciate you taking this time on a Saturday morning to learn more and to ask questions, and we are really grateful for your time. So with that, I will turn it back over to Dr. Akintobi to share some final words with you all.
Thank you so much, and I echo all that Dr. Goldberg shared and all of the panelists. Thank you for spending some time with us this morning to talk through where you are. I always joke in thinking about what my 13-year-old started talking about when he was in his early learning center. And I'm like, I wish that folks talk to me about considering my why. You know, why is it that you make decisions? What motivates you? I'm catching up now, but I think, you know, now is the time when we think about COVID and the reasons why you're even on this call, and even the places where you live and where you lead. What is your why? How can you be a source of influence, and even for yourself as you think about getting vaccinated, and even just decisions surrounding being safe and considering the health of our most vulnerable, our 0 to 5-year-olds, etc., and others? What is your why? Hopefully through today's discussion, you've heard some things that have either affirmed you, have enlightened you, and more importantly, have given you resources to expand your why as an influencer, as a parent, as a teacher. So I would love to turn this over to Brittany Taylor, who we certainly want you to know as we think about Georgia CEAL and the resource that we are to you for all of this information. So the Centers for Disease Control and Prevention is certainly a great resource. The National Institutes of Health are great resources as well, but we want to help to kind of distill and kind of filter that information so that you don't have to go as far. So Brittany, please, we'd love to hear from you in terms of resources that people can use and access.
Good morning, everyone. I am Brittany Taylor. I am the project director for Georgia CEAL. I have served as a preschool Sunday school teacher, so I definitely understand the importance of protecting our precious little ones, because as we know, they love to be cuddled up under us and each other. So I pulled some early child care resources from the CDC website so you can more so put your hands on and see what they're offering. And so we know as a part of prevention, washing your hands is very important. And then this is just making it fun for them and illustrating how they should be washing their hands. And you can also add that they can sing the happy birthday song, as we know that provides the correct length of time that they should be washing their hands. Or maybe have them say their alphabet. That will also get that length of time in there for them. Here to my right, I think yours too, and I'm sorry, my dog is coughing in the background, so please excuse him. Here are some COVID-19 symptom screening flowcharts for you to check with your child or any children that might be entering your child care center, and just walks you through, can they proceed in entering or should they be going home? And then here to the left, I'm sorry, it's not bigger, but it talks about how to show signs are shown in the classroom and what you can do as a child care provider with those children. So just make sure you're separating them from the rest of the class, informing school administration, make sure you're cleaning and disinfecting, identifying those close contacts because we need them to quarantine because we don't want them to get it. And of course, notifying their parents as well. And then here is a resource from We Can Do This on how to communicate with adolescents and parents. So it's just giving you some good facts and talking points on how you can communicate with them about COVID-19 and getting vaccinated. And then lastly, there are a 2-page slide on how you can set up your ECE center to prepare for servicing these young children, even though they have not been vaccinated, and to, I guess, help prepare you and protect you along with them as well and their family. And then here to the right, again, from the We Can Do This HHS campaign, you can also let them know that free childcare services are available when they're getting vaccinated. And they can just go to vaccines.gov or call that phone number or send a text message, and they will be provided with places that will provide childcare for them while they're getting their vaccine. And that will conclude my brief presentation. I hope it was helpful for you all. Oh, and I'm sorry, I meant to add, I will make sure that these go out to you all. We'll send the links to all of these specifically. Sorry about that.
Thank you, Brittany. We appreciate that. Dr. Akintobi, are there any final words that you want to share with our attendees today?
I think this has been a wonderful opportunity to listen, to hopefully create a safe space, and to let you know that GEEARS and Georgia CEAL are here to serve you, and we look forward to doing this again. Please remember your why, and I think another call to action is to share the information once you get it. Share it with those you care about, those you work with, and I think collectively, Dr. Goldberg, this will be our path forward to a safer Georgia, particularly for our little ones. Great opportunity.